So today I'm going to talk about computed tomography, MRI, ultrasound, radiography, general overview, and their advantages, radiation, axial, coronal, sagittal section. First of all, let's talk about radiology generally. What is radiology? Radiology, it's a medical discipline which uses medical imaging to diagnose and treat different kinds of diseases within the bodies of humans and animals. We have different kind of radiology techniques, including X-ray radiography, ultrasound, computed tomography, nuclear medicine tomography, fluoroscopy, and magnetic resonance imaging. Radiology has central role in management to disease management, and it is early diagnose. It gives us early diagnose ability. First, I will talk about X-ray. What is X-ray? X-rays are photons, a type of electromagnetic radiation which are generated from a complex tube. This tube is filled with vacuum, and after producing these X-ray beams are passing through our body, into our body. X-rays are attenuated. Attenuation means reduced in energy, reducing in energy. And these X-ray beams are attenuated by the different tissues in a different way. Because of this, we see different tissues in a different color. For example, air attenuates X-rays a little. Because of this, we see air as black on X-ray. Fat attenuates X-rays more than air, but less than water. And both bone attenuates X-rays the most. Because of this, bone is white color on X-ray. Here are located lungs. And because the lung alveoli is full with air, we see lung is black in color. Here, for example, clavicle bone, vertebral column, ribs, or scapula, all are white in color. And fat density will be like here. I will show later. Here we have how it looks on X-ray, different kind of densities. For example, first is air, second is fat density, 3 is fossa tissue, and 4 is bone density. Here we have abnormal X-ray densities, too light. For example, here this is a soft tissue density mass that has destroyed a rib which is missing, and this area, because of this missing of rib, this area looks too dark. What are the advantages of X-ray? X-rays are non-invasively and painlessly. It helps to diagnose diseases and monitor therapy. It supports medical and surgical treatment planning, and it guides medical personnel while they are inserting, for example, catheters, different kind of devices inside the body, treating tumor or remove blood clots or other blockages. Another advantage of X-ray is that it is cheap examination method, and it is comfortable for patients. For example, here we have X-ray. We see part of vertebral column and skull and facial bones. This is lateral view of X-ray. Here is under posterior view of hand X-ray, and we can differentiate hand bones. We can't differentiate any soft tissue here. Principles of radiography. I want to talk about contrast material. What is contrast material, and for what do we need contrast material. Some organs and tissues lack of natural contrasts, and we use contrast material to highlight special parts, special organs of the body, to make them easier to observe during the exam. This contrast material, first of all, must be safe and non-poisonous for a patient. We have different types of contrast material. Here is high density, for example, barium, iodide, and low density, air, for example. Also, there is different ways to enter the contrast material into the patient's body. First is peroral contrast material. When patient swallows this contrast material, for example, barium, barium swallows, and after the patient swallows this barium fluid, we observe gastrointestinal tract. We see this barium contrast material first inside the esophagus, then goes inside the stomach, small and large intestines. Second way is intravenous. When we give patient this contrast material via the catheter, for example, so intravenous way. And in this situation, we will see contrast material inside the vessels. Next one is retrograde. For example, an example of retrograde contrast material is when we enter this contrast material from anal canal, and last one is intravaginal way, when we give to patient this contrast material with vaginal canal. Here on this picture, we have an example of without contrast and after contrast image. So this is abdominal X-ray without contrast material. We see that there is located intestines. Inside the intestines, we see only air level. We can't talk about intestines. We can't say exact location of these intestines. We can't talk about any disorders. Is there happening? Is there any disorder inside the intestines or not? So we have given to patient contrast material, barium contrast material. This patient swallowed this contrast material and came to hospital to check X-ray film second day. And second day, their large intestines are full with contrast material. And you see, this is visible. We can see the exact location of the intestines, the length of intestines, haustration of these large intestines, and also we can see if there is any kind of disorder inside the intestine walls. So this is ascending colon, transverse colon, descending colon, and sigmoid colon here. Next one is ultrasound. We will talk about ultrasound. Ultrasound is a high frequency sound wave, not electromagnetic radiation. I have told you that X-ray has electromagnetic radiation, and because of this radiation, X-ray is harmful because this radiation can cause molecular changes in the human's body. What about ultrasound? Ultrasound is a very high frequency sound wave, not electromagnetic radiation, and these sound waves are generated by piezoelectric materials. So for example, you hear now my sound, my sound, and I produce these sound waves, which you can hear. Ultrasound uses sound waves, but they are upper audible limit of human hearing. So we can't hear the sound waves which ultrasound uses. And here we have example of ultrasound, liver and kidney here. You see. Here also fetus inside the womb. You can, at 12 weeks of pregnancy, you see body, head, body, and lower limb of the fetus. So generally, here we have liver ultrasound. We describe ultrasound findings in a density, in a echogenicity. What does it mean? If we see any kind of mass, for example, if I see mass and I should describe this mass. So I use different kind of terms to describe ultrasound findings. This is hypoechogenic, hyperechogenic, anechogenic, and isoechogenic. What do they mean? For example, anechogenic means when this area has no echogenicity. For example, this is anechogenic. Actually, this is anechogenic, has no echogenicity. For example, if you compare these parties very white, you see, to liver parenchyma, you can say that it is hyperechogenic than liver parenchyma. If you, so anything that has more echogenicity than what organ you are comparing will be hyperechogenic. For example, this part and this part has same echogenicity. Yeah, we can say that they are isoechogenic. And here is the example of hypoechogenic. There is left lobe of the liver and kidney parenchyma. If you compare kidney parenchyma to liver parenchyma, you can say that kidney parenchyma is hypoechogenic, so has less echogenicity than liver parenchyma. Doppler ultrasound. What is Doppler ultrasound? It's a non-invasive test which can be used to estimate the blood flow through blood vessels. It uses also sound waves of ultrasound, and we use this Doppler ultrasound to diagnose many conditions. For example, blood clots, poorly functioning valves in the leg veins, heart valve defects and congenital heart disease, blocked artery, arterial stenosis, decreased blood circulation, and so on. Here we have example of Doppler ultrasound. This is liver and liver vessels. After putting the special window of the Doppler on this liver vessels, you see that it will be colored in a red or blue color. This is red in this case. Here we have Doppler ultrasound of aorta. You see that aorta is red in color on this Doppler ultrasound. What are the advantages of ultrasound? They are generally painless and do not require needles, injections, or incisions, and patients aren't exposed to ionizing radiation, making the procedure safer than diagnostic techniques such as X-ray and CT scans. Ultrasound captures images of soft tissue. Now, for example, I have told you that on X-ray you can't differentiate any soft tissue from each other, but ultrasound captures these soft tissue images. Also, it is safe, and we recommend, because of this, to pregnant women ultrasound examination. Computed tomography and magnetic resonance imaging. So what is computed tomography? It's a scanner which obtains a series of images of the body in the axial plane, not in the axial, only in coronal and in sagittal plane. Here is ultrasound computed tomography machine, and patient lies on this bed. This bed is moving inside of this part, and here are detectors which producing many X-ray beams, and at the end this X-ray tube passes around the body and a series of images are obtained. So computed tomography scanner uses X-ray. Remember, because of this, both X-ray and computed tomography will have electromagnetic radiation. And it's harmful, hazardous for patient because of this radiation. Now about magnetic resonance imaging. The process of magnetic resonance imaging is dependent on the free protons in the hydrogen nuclei in molecules of water. It uses radio waves, and it's not harmful for patient. It hasn't a radiation level. Here we have the example of computed tomography, coronal plane. I will explain later what does coronal plane mean. Thorax part, and you see bones are white in color, air is dark as on X-ray, same. Here again, abdomen of computed tomography scan, abdomen, coronal plane, and you see that here is used contrast material, peroral contrast material, because stomach and intestines are full with contrast material. Intestines and stomach without contrast material should be the color like, for example, liver. So soft tissue density, it should have soft tissue density without contrast material. What are the advantages of CT scan? A major advantage of CT is its ability to image bone, soft tissue, and blood vessels all at the same time. And it provides very detailed images of many types of tissue. Advantage of MRI. So what is the advantages of MRI? It's ability to provide better soft tissue contrast than a CT scan, and for example, and can differentiate better between fat, water, muscle, and other soft tissue than CT scan. Another advantage of MRI is also that we can observe cerebral vessels. So cerebral vessels means vessels inside the brain without contrast material. So on MRI, we don't need contrast material to observe cerebral vessels. On CT scan, we use contrast material to see cerebral vessels. Here is, for example, a case of abdominal, thorax part and abdominal part of MRI. So what is the difference between MRI and computed tomography? How do we differentiate them? Bones are always white on computed tomography, but on MRI, bone is dark or gray, so black or gray. Also, fat and water in different sequences. We have different sequences in MRI. This is T1, T2, and flare sequences. In different sequences, fat and water are white on MRI. On CT, fat and water is almost never white. Here we have brain MRI, a sagittal view. How to tell difference between a CT scan and MRI scan. I have told you about this already. And about radiation, I will tell that there is radiation. It's generally energy which comes from a source and travels through space at the speed of light. And we have four major types of radiation: alpha, beta, gamma, neutron, gamma, electromagnetic waves, for example, X-ray. So why it is harmful for patient? Because when radiation is absorbed within the bodies, it can cause damage of molecular structures and potentially cause harm. And if patient is exposed with a high level of radiation, patient may have a range of effects such as vomiting, bleeding, and hair loss. Now let's talk a bit about planes of the body. We have three planes. This is coronal, sagittal, and axial plane. So sagittal plane divides the body into right and the left portions, into the right and the left parts. Coronal plane, so frontal plane, same, divides the body into anterior and posterior portions. Anterior means front, posterior means back. And axial plane divides the body into superior and inferior parts. Superior means upper and inferior means lower. For example, here we have computed tomography, abdominal part, coronal plane. MRI, axial plane, sagittal, and coronal plane. Computed tomography, axial plane, thorax. This is soft tissue window, and here we see lung window. So computed tomography has different windows, which we use due to what we are searching. For example, if you want to see and you want to see better the soft tissue, you use a soft tissue window. If you want to see bones better, you use bone window. If you want to see lung parenchyma, you use lung window, and so on. There is brain window, also angio, special option also. Here, computed tomography. Why computed tomography? Because we can differentiate soft tissue. We can see bone. We see bone as white. So you can say that it's not MRI and it's not X-ray, definitely, because I can differentiate soft tissue. So it is computed tomography and coronal plane, because I know that coronal plane divides the body into anterior and posterior parts, so into front and back parts. Sagittal plane, computed tomography, and bones are white, so I can't think that it is MRI. Also, I can differentiate organs and soft tissues. What is medial and lateral? Generally, to describe any kind of radiological findings, we need to use different terms. For example, medial and lateral is one. What is medial and lateral? You should imagine mid-sagittal, so midline on the body. Everything what will be near this midline will be medial. Everything what will be away, far from this midline will be lateral. For example, you can imagine on your face, your nose is medial to your eyes. Your eyes are lateral to your nose. Your ears are lateral to the eyes, but eyes are medial to the ears. Anterior and posterior. So anterior means front, posterior means back. For example, your face will be anterior part of the torsion. Your vertebral column will be posterior part of the torsion. Superior and inferior. Superior means higher, inferior means lower. For example, nose is superior to the mouse. So chest is superior to the abdomen. Foot is inferior to the knee. And that's all for today.